Hello. Let's talk about today diabetes. Diabetes is a very important and a very normal phenomenon in today's population. So let's begin with talking about it. What is it? What is diabetes? Generally, how when we see patients and when we define them what their disease is, then we simply explain them that diabetes happens when somebody's body is not properly functioning, somebody's body does not have enough insulin. Insulin is something which body itself produces and which is not produced by that kind of patients. Now, figuring about what type of diabetes the person must be suffering. There are mainly two types of diabetes, type 1 and type 2. Children and young people usually get type 1. Sometimes they also call it juvenile diabetes, which is simply referred to child or a young person. And the other, the old age group, or the simply the second group or the class, is considered a type 2 type of diabetes. Now the next question comes is, how do we get diabetes? Like, how can a person be diagnosed with a diabetes? It happens when the islet cells in the pancreas are damaged, which are responsible to make insulin, to create or to build up insulin. So when they are damaged, insulin is not produced, and then that is causing diabetes. Type 1 diabetes, when the person is diagnosed with this type, it's really complicated as because genes that the child got from this parents, and that is responsible for them to build this diabetes. And the child gets an infection. So mainly there can be many reasons. One can be a hereditary problem where the diabetes is being transferred through the genes. The second, when the child gets an infection from a virus and the inflammatory system can be rooted, and then it causes diabetes. Other than these categories, for few people this infection triggers the body's immune system, so that instead of attacking only germs, the immune system starts attacking to its own body, and healthy body cells, such as the ones that make insulin, are damaged in that process, and then the person is started suffering from diabetes. Now the next is, how do we attain these symptoms of diabetes? How do we know, acknowledge ourselves that we are suffering from diabetes? A person starts feeling more tired than usual. He or she may be feeling more thirsty, wanting to wee a lot, even having to get up in the night, losing weight. Often a child will then get very sick, being weaky and sleepy, and they all have a black under eye marks, and that's all lack of sleep. Now the next question is, how, if we are diagnosed, then the next part is, how do we manage diabetes? Children with diabetes must watch what they eat and especially never skip a meal. They should be consulted and counseled as well. The same time, that what is beneficial for them to eat, to do, to exercise, and what not. And regularly the sugar levels in the blood, using a drop of blood from pricking a finger, should be checked. That will count the sugar level in their body, and if it's high, then they would avoid the kind of food which increases the sugar level, and if it's low, then we can substitute the person with a sugar content food, unlimited sugar content food. Properly and regularly they should have insulin injections, do various and regular exercises, have as much fun as other kid has. Now, in a very general and a very lame language, when we define what is insulin, insulin is like something. When we talk to patients, when we counsel them, we tell them that insulin is like a key to a door. Insulin opens the doors to the cells of our body. When the doors swing open, the sugar in our bloodstream enter our cells, and our body uses that sugar for energy. So the energy or the enthusiasm we work with is developed by insulin. So not to worry, if your body is not creating insulin, that doesn't mean that you are not enthused. That is definitely for sure. But the supply will be different. If it's not naturally built, will create or will artificially provide one. And this is the simplest way I explain my patients. and or a very, a very natural and a very very pitiful phenomenon, like situation when you explain kids how diabetes and how they're affected to it. So that was how diabetes and this natural awareness can help people. So take care, be safe, stay healthy, and keep on watching. Stay connected. Bye bye.